Right. Okay. Can you see my slides? Yes. Okay. Fantastic. So I'm going to talk about Barbara. Let's meet Barbara. She's a farmer, as you can see, and I don't know anything about her because she's really just a stock picture. But let's assume Barbara is a farmer from Austria, and this is her, carefree before COVID, everything's happy. And then COVID happened, of course, and I want you to take a minute, like 10 seconds, to think about what happened to Barbara. COVID-19, what happened to Barbara? Think for it a little moment. Okay, so I'm sure you got some ideas what happened. Now, luckily, Barbara didn't get affected by the virus, but maybe you got infected, you got affected by COVID. The many things that happened. We had restrictions on movement, and that's what I want to talk about today. So Barbara was also affected by that. Yes, so I really want to focus on this today. When we talk about restrictions on movement, I really want to think about restrictions on your individual freedom, like Barbara wasn't allowed to meet her neighbors anymore, and the good for society. You know, you want to get over this pandemic as quickly as possible with as few people dying as possible. So it's this balance between the two things. And what I want to highlight today is how the balance changed, this balance maybe, and also how it revealed this this balance between individual freedom and what's good for society. Right. So maybe as a farmer, Barbara's a bit less affected because she could still go in the field and work. She could roam and walk around. But yeah, she was a bit sad. She couldn't talk to her neighbors. Shopping was difficult, like it was for us all. But yeah, it wasn't so difficult. Now then, this happened. Barbara saved up for her holidays for the first years. She didn't go on holiday, and she really wanted to go on holiday. And it was COVID. Well, what happened? Well, what happened to holidays during COVID? It got cancelled, right? So sad. Of course, Barbara was a bit sad. And it's like, okay, she really started thinking about, well, of course, I can't go on holiday. The planes didn't go, etc. But then she started thinking about what is the cost of a healthy society. Okay, we all chip in, we do our part, but you know, what's the cost? What should I pay for it? And well, how much do I contribute for it? And yeah, she really started thinking about this, and she didn't slip into like her uncle. I was thinking of her uncle Albert. He was really like becoming upset with the restrictions and said, well, I shouldn't pay for it. And he slipped into all these conspiracy theories. Barbara was more balanced. She really wanted to understand what's going on. But she realized there is this, what we call the free rider problem. Everyone benefits from people staying at home and from the health policies that were in place, the restrictions. But as an individual, if everyone stays at home, I have all the incentive to go out and, you know, just walk around in the city or something like that, meet with my friends. And there's this challenge. Yes. Then Barbara was also thinking, oh, what if not everyone is affected the same? Well, you know, she was a farmer. She realized she had the freedom to walk around on the fields. Others live in the city, in a crowded flat. It was not the same situation. And not everyone has the same means. Some people have a big apartment, lots of space. Others are crowded places. So it's not the same. So these are philosophical questions. I just want to bring them up. You're at EuMigs, so you can think about them. Think about questions of justice, what's right, what's good for society. Just one word on that. There are different principles of justice. So there are no easy answers to that. Right. So let me introduce the next challenge for Barbara, of course. It was harvest time. Okay, of course, I chose coffee beans for a picture of Barbara in Austria, because it's growing coffee. Now, there's the stock picture I got, of course. But it stands for the fruit pickers, okay? Barbara is farming strawberries maybe, and well, there's lots of strawberries to be picked, and it was harvest time, and oops, we have restrictions on movement, right? What happens? Barbara could never pick all the strawberries on her own. So it was a bit difficult. Her fruit pickers were stuck in Romania as they were just there, and it was a bit difficult. Now, she was not the only farmer, of course. In Austria, she was not the only farmer anywhere in the world. So she wasn't the only person to realize there is a problem. We have restrictions on movement and I have a real need. Otherwise, my strawberry is just going to rot on the field. And yes, as restrictions were introduced, there were calls for exemptions, like for healthcare providers and, of course, for farm workers, like somebody has to pick up the harvest. And yeah, as COVID continued, more and more exemptions were granted because it was on this balance again between what's good for society and what's good for the economy and individual freedom. It was finding that right balance there. And yes, we're getting into that gray area between good for society, clear restrictions, and good for economy. It wasn't so clear anymore. And it was that gray area, what is essential, what is necessary for the economy. And then we enter the realm of politics, of course, as soon as we have gray areas. Barbara's not sad for long because there was a special program in Austria where she could recruit her fruit pickers from Romania. They had flown them in directly and they worked as usual. And yes, one thing I want to highlight is here, talking about immigrants, to debate the political side. I said, you know, it's a political aspect, and we tracked how the political parties in Austria talked about migrants during the period of COVID-19. And as you can see on this graph here, we have the center-right Austrian center-right on top, and you have the left-wing party at the bottom. And I think two things you can see here is at the bottom, you can see the left-wing party. They speak more positively about immigrants in general. That's nothing new. That has not changed with the pandemic. And then you have the center-right, who tend to be have more restrictive positions. And what happened is in the debate, we have this new concept of essential workers. And as you can see for the left-wing party at the bottom, it doesn't make much of a difference. They're just positive. They support migrant rights, support asylum seekers, etc. But for the center-right, that category of the essential worker allowed them to be open, be more inclusive, support the rights for some workers, and still maintain a negative or a neutral stance on asylum seekers, for example. So it was a kind of a rhetorical trick, if you want, to separate migrants and say, well, they have more important, they get special rights. And this is also what happened. Yes, so I've already moved away from Barbara and I'm talking about restrictions, and I'm sure you remember there were lots of restrictions, and this is the global picture of the new restrictions. I'm focusing here only on mobility restrictions. And you can see at the beginning, left of the graph here in January, the first few things trickled in, and it was in March when it really started to pick up, when we have, we traced the changes over time, and then you have like over 6,000 restrictions globally being introduced on 18th of March. This is really when a lot of restrictions happen. And when I say we, that's a team led by Lorenzo Piccoli and a lot of PhD students and who helped us code all the different restrictions. Yes, so they volunteered their time, and we have this big database that's now available for everyone who wants to understand how these restrictions developed over time. Right, so yes. Yes. So you have these peaks, and I think if you look at 18th of March, if you go back in history, it was the World Health Organization who proposed some restrictions, and then of course a lot of countries followed on that. Okay. Now, because we have this database, we can also look at the kind of restrictions that were implemented. Now, here we have, if you look at the x-axis, you have time from March until October of 2022. From March 2020 to October 21, and you have just the number of restrictions over time. And you can see how it developed over time. So the first thing that happened are the entry restrictions. I'm sure you remember that. That was beginning, well, let's do something, let's react to the pandemic. We close the borders in one way or the other. Okay, so that was the first reaction. Then as we learn more about the virus, as the scientific knowledge increased, we had other conditions, in particular we had medical measures. So it was like, okay, you cannot come if you're infectious or etc. So the medical reasoning become more important. It makes sense in a way. Well, we know more about the virus, we know how to handle it. But if you look at the entry restrictions, our first response, they go down a little bit, but they don't go away. So it's this global blanket response, let's close the border, that was implemented, and it was still there and it kept staying there. So I think one lesson we can already see here is that implementing restrictions was easy in that context. Getting rid of them was more difficult. And even today we have, with 23, we still have entry restrictions. We have visa restrictions that are still in place, even though formally by the World Health Organization, the pandemic is over. So it's easy to restrict the rights, and it's more difficult to remove them, apparently, politically. Right. So if you look at the target, like who is targeted with the restrictions, I think, yeah, you can see the presence is the most important one. So it's if you stayed in a country with a lot of infections, initially it was China, then it was other countries, then you should not be allowed to come in, or you have to test and go in quarantine, etc. That makes medical sense, I guess. And then you have the next category that we have is nationality. And that's so you're not allowed to come, or we have to go into quarantine because of your nationality, because of your passport. It doesn't really matter whether you stayed in that country or not. And that's, if you think about rights, I mean, we talk about citizenship. Yeah, it's not so logical that if you can measure presence, and we can ask, have you stayed in China? Have you stayed in Italy before you come to your current country? Why should we look at nationality? And then you also have those who look at residence. That is kind of a compromise between the two. So the restrictions were quite broad, and many of them are looking at and taking like nationality as a very broad brush approach to restrictions rather than looking more carefully. Yes. Okay, and that's the graph for Barbara. Of course, she wanted to go on holiday. So over time here, you have the number, a selection of countries, and on the y-axis, you have the number of countries you can go without having a visa. You just go there and they let you in. So the number one on that graph is Germany. So before the pandemic, Germans could go to 121 countries, just turning up at the borders, and they were let in, no questions asked, etc. So you can see on the left of the graph, you can see this north-south division of rights, of freedom to move. So countries in the global north, they can go to lots of different countries. And at the bottom, you had Afghanistan, which is go like, was it 6 or 7 countries without having a visa? Everything else was locked in principle. So you have to have a special case and permission to come into the country. As we get into the pandemic, that's where everything goes down. You can see that. So when we show this picture, some people react and say, well, the pandemic makes us all equal. And I just wanted to highlight, well, that's not the case. Even if you look at the right hand of the graph here, yes, it wasn't so easy for Germans just to turn up any border anymore, but still you have this hierarchy. It was still that Afghanistan and Iran are at the bottom and they just couldn't travel. And still the countries from Western Europe, which are most free to go to other countries. So the hierarchy is still there. and this is a temporary thing now. The visa-free travel is coming back, and it hasn't changed anything for Afghanistan. So even within the pandemic, you have this hierarchy of who has more rights and who has less for that. Yes. So yes, as I mentioned before, with the restrictions, even some of the visa-free travel restrictions are still in place. Like, it was easy to impose visa restrictions, and apparently politically it's difficult to get rid of them. Right. So that's the restrictions, and as we saw with Barbara for her fruit pickers, there are also exemptions, and these are kind of the list of exemptions that we have, the different criteria, and what's the reason that you should be exempt from the border closures, for border movement, restrictions on movement. And the first is, well, we've seen lots of nationals being excluded, but then nationalities being a reason to be exempted from rules. And one main reason there is that, okay, we close the border, but nationals of the country can still come in. Okay, and that's basically a basic right. If you look at your passport, it probably says somewhere, with this passport, you're always allowed to come back into your country, right? And that's the citizenship right that's been maintained even in the pandemic. So maybe medically it wasn't the cleverest thing, but in terms of citizenship rights, that didn't break down. Then we come to the resident categories. That's a kind of you have this right, but you don't have the same right as your passport. You always come back, but in many countries you're still allowed to come back in where you live. Yes. Yes, and then if you go further down after that, it's groups of people where citizenship rights are not really useful to understand. Should they be exempted or not from border closure? So we get, work and business related travel, that's economic needs, and that's not about citizenship. But if you look at the list, you have also interesting the family of residents internationally. That's only 21% of the restrictions had an exemption for family members. So we have rights for the individual, but their family members is also a right, a citizenship right, that's not been honored. And if you go further down, also at the bottom, you have humanitarian protection. That's been very, very rare that there was an exemption for that. So if you look at the pandemic, all the humanitarian protection, if I overstate it broke down, the system broke down. It's just the borders were closed and they got stuck somewhere. So yes, that's just that. And maybe the last thing I want to highlight is, if you look at the bottom here, is tourists. In many places, tourists are very important for the economy, but there's also a lot of movement of people. So it's not just, if you want to go into conspiracy, not just the economy was protected. There was a political deliberation. What parts of the economy are important, and what parts of the citizenship are important, and where do we compromise? So it's not just economy with any reasons here. Okay, here we have the changes over time, and I found it interesting because it basically see no changes. There's only one in the middle where you can see the children. So the exemptions for children increased in numbers over time, and for the other kind of exemptions, it just was relatively stable. So as there were more restrictions imposed, the share of residents or nationals being exempted was roughly the same. What changed is really that over time there were exemptions for children. So if you below a certain age, you can still come, you can still cross the border, you can still move, you can gather, etc. There were a lot of medical debate around that, and whether, this is reasonable or not. I'm not the expert on that. Right. So that's the data that we have. We have collected the data on mobility restrictions, and we were thinking, like, what can we do? And that's where you come in, of course, students, researchers, and citizenship. And we have 5 broad lines of research avenues that we think could be useful with this data. One is to drivers of mobility restrictions. We have seen this increase of mobility restrictions. Why is it that some countries have more of them? Why are some of them still in place, others take them back, etc. Then we can look, if you look at these questions of dispersion, like the patterns of policy convergence and divergence. So why is it that some countries have their own policies, and why is it that some groups of countries have the same policies? We can look at the legality of mobility restrictions. Was it legal? It was easy to impose restrictions, but the legal question was often just on hold. We can look at continuity and change in global migration policy. So we've seen, the decrease in visa-free travel, but we can track that over time further and see, like, what's the continuity, what's the change there. And we can talk about our citizenship, of course, mobility rights. What's the right, my individual right, and what's the good for society? How are the two in balance? Here's just one graphic just to show you that this is feasible, so we can do something with that. These are political correlates. And if you can see anything in this graph, my conclusion is that liberal countries took longer to, so countries with more liberal governments and less, not the dictators, so have a liberal democracy, they took longer to implement the restrictions. And we have that in all the three graphs where there's not a flat line. It's about liberal democracy index, electoral democracy index, and this measure of liberalism. So we can see that more autocratic countries were much quicker to implement restrictions. And we can also see that immigration in itself, so if you're in a country with a lot of immigrants, that doesn't make a difference. So you can, of course, develop this, research more on this kind of thing. And I'm going to conclude, because I'm going to conclude somewhere. My conclusion here is that, well, COVID laid bare citizenship in a positive sense that, you could go back home if you wanted to, if that's your home. Your passport was honored. It was essential, but it was all a way to, we've seen in many restrictions that are based on nationality and not on medical reasons. So, yes, we have a lot of restrictions, and with all the restrictions, we had lots of exemptions. And I think with this data, if you're data-driven, or if you're less data-driven, you will think about this, there's potential to use COVID-19 as a tool to understand what is citizenship, what's essential, and where do we make compromises and why. And with that, I'm going to stop.